whole bunch. You unplug the HDMI, does it work? HDMI, does it work on your laptop? Okay, well, let's see if it gets there. It's not the saying he's not hearing anything?
Of course, I'm also just listening to here.
Oh no, actually on his end. He's not hearing like that tapping.
Is the sound up in that? Because they were fooling around with the audio off that panel.
What do you mean on their live stream? Right, they do. They can see it.
I'm here, and I'm hearing right here.
You can hear
Watching the same thing. You should be watching it.
Yeah, he says he can hear it. Okay.
Hey there, testing, testing. Just testing for the audio for the overflow. Testing. Thank you.
They're cool.
Is it for,
It's for amplification in the room,
okay, so,
and it's for them as well.
all right. So Harvey, you could hear? Can you hear? No,
We can turn up the volume.
we can try. Okay, testing, testing, testing. Can you hear? No? Just barely. Oh, okay. Good.
How's that?
I think it's good. Probably good. You might have to, you know what? Let me do this first. This is going to be in the way.
Yeah, we can adjust the volume, make it louder or better.
Right, okay.
So we're going to put this on? Yep, sure, that sounds great. And do you have one of these? So you're going to sit on the left there, or you?
Right.
Because then I'll put mine on.
Good.
There's a mathematical theorem about that.
Here we go.
Whatever can go wrong will go wrong.
Murphy's Law.
That's right. Yeah, there's a law. Actually, let's get this way.
So it's on now, so talk.
How's that? Can you hear me? Can you hear me? Is that good? It's probably pretty good, right? Yep, good.
Okay.
Thanks.
So I'll mute those two for now. If you leave them on, I can just mute it on my end. So they're muted now.
Said he was.
Yeah, because then she said, okay, what's on now?
afternoon filled with great science. And before great science, we're very, very honored to welcome our great president, Mark Levine. So I have a few words to say, but I also want to welcome everybody to our fireside chat, or maybe it's even more appropriate to call it a campfire chat, because it's still summer, right? We don't have s'mores. Sorry about that.
Yeah.
So first, let me just welcome you to BioX, to the home of BioX, the Clark Center. Today is marks one of our symposia, BioX Symposia, which really celebrates the interdisciplinary seed grant program. And this is a program, it's actually 20 years old. It was started in 1998 with a small number of seed grants, but a big vision. I see some of our visionaries even here today. Thank you for coming, like Lucy Shapiro's here, for example. And it's grown over the years to be a really, I think, a wonderful way to support faculty from many different disciplines and many different parts of the university in interdisciplinary research. And just to give you a few numbers, starting 20 years ago to now, we've actually funded about 100, well, not about, exactly 187 seed grants. Over 900 faculty have actually belong to the BioX program, and we've received over 900 or so letters of intent, which is actually amazing. So over all these years, 20 years, that's amazing, because when you think of how many faculty have been engaged, for every letter of intent, it's collaborative. So at least 2 faculty members from different parts of the university or different disciplines have to be part of it. So when you think about the total number of faculty that have been engaged, it's really awesome. And I have to say that really I want to thank the faculty and students who have been part of this program over the years, because the program is you. This is what makes the program, and there are really 2 other extremely important components of success that I want to thank today. And one of those components is the BioX team headed by Dr. Haida Fateh, amazing team that supports BioX and the Clark Center. So you see some of them around you now. I don't know where Haida is. She always hides when I thank her, but we wouldn't be here without them. Haida, we're thanking you now. Thank you. Oh, really? Oh, wow, okay, thank you. All right, that's nice and cozy. And I also really want to thank Harvey Cohen, who's here today, who is, in fact, the chair of the Seed Grant Selection Committee and has been so ever since it started. So, Harvey, thank you so much for 20 years. Well, it's really an honor for us. Thank you. And let me just say, too, that the seed grants are given every other year. So we've given out about 8 rounds of seed grants, and we've asked everyone how they've used that initial seed money to leverage if they've been successful. And it's quite amazing. The first 22 million, maybe it's 24 million. And Ann Arvin, yay, our boss. Yay, Ann. Welcome. So as you know, Ann is the outgoing Dean of Research, and in fact, it's very nice to see Cam Moeller, who's the ingoing Vice Provost and Dean of Research. So this is a wonderful moment for all of us. And as I said, that we've given out 8 rounds of seed funding, totaling around $24 million over the course of that many years. And that's been amazingly leveraged to over $280 million that's been received by you guys, in external funding. So this is an amazing success story not only in the monetary way, but really in terms of innovation and invention. That's the most important thing. But turning high risk, potentially high reward ideas into really exciting science and medicine. And I also really want to thank Mark Levine and John Hennessy, because without their support, matching the support of many, many generous donors, we would also not be here today, because the seed grant program has really been funded over the years by the Office of the President and many donors. And we're very pleased to say that we're very much on track to have the entire seed grant program fully endowed. We may be there now, but I think it depends. I think it actually depends on the budget and the interest rates for the coming year. But in any case, it's really good. And that also wouldn't happen without everyone's support, because we can't really convince anyone that this is a good program unless there's really good science and medicine behind it. So again, thank you, everyone. So now, Mark, President Tessier-Levine, I'd like to really welcome you. Quick introduction. Mark and I go way back, so if I say Mark.
Please just call me Mark.
Thank you. Really, especially around a campfire, right? I mean,
That's right.
If it weren't a campfire. But I do want to just say a few words about President Tessier-Levine. Many of you may know that he's actually, in addition to all his other accomplishments, a world-renowned neuroscientist. And he received his undergraduate degree at McGill University in physics. And then he went to University College London on a Rhodes Scholarship, and he received his PhD in physiology, and that was really the beginning of his interest in neuroscience. And then he went to do postdoctoral work at Columbia. I think that's where we actually first met each other. And I just have to say that I just would like to read a very notable paper, the title, not the whole paper. The title of this paper is "The Nectrins Define a Family of Axon Outgrowth Promoting Proteins, Homologous to C. elegans Unc. So what Mark had done was made a major discovery, beautiful science that in fact identified the first guidance molecules that could be studied in the vertebrate nervous system. They had been postulated, they'd been studied genetically, but Mark actually, through amazing biochemistry and molecular biology, purified and then cloned these nectrins and then showed their function. And that was a big deal in 1994. So this was not a trivial thing like you would do today. So it was a very, very important step forward. And that brought Mark here to the Bay Area, to UCSF, where he began his faculty careers, came to Stanford, then was recruited to Genentech, where he was the vice president for, I guess the vice president for research, the CRO, right?
CSO.
CSO, yeah. Scientific research. And he had a very different hat there and could talk just as easily about cancer as about neuroscience. Was recruited to Rockefeller University, where he was the president of Rockefeller University, and then came back to Stanford, where we see him now, and we're very, very, very happy to have you here now. So thank you so much, Mark, for coming back, and also today for joining us. So our plan today is, I have a few questions I'd like to ask Mark. You might keep in mind, if we have time, I hope we will, some questions that you would like to also pose to the president. And then we'll have another moment or two, and then we'll run upstairs and have our poster session.
Thank you.
So let me just start with one question, although you can interrupt and go off-piste anytime. You're the boss.
Okay.
So the first is really, I mean, many of us, I think, want to know a little more about long-range planning. You know, you and Persis have led an intense process. The deans are laughing.
Yeah. It's nervous laughter.
You know, you've led a really intense process over the last year or so, and we're sort of also thinking, how can we help? How can BioX fit in? And we want to know a bit about the priorities that would be relevant to our BioX community, which, remember, is over 900 faculty, so maybe it's sort of broadly spread across the university. You know, the mission of BioX is to catalyze discovery by crossing all of the interdisciplinary boundaries in aid of human health and knowledge. So if you're willing to share some of this with us, that would be wonderful.
Great. Well, I'm delighted to share, but I just want to first start by thanking you, Carla, and also the BioX community for inviting me to be here today at this campfire chat. And I hope we'll be able to roast some marshmallows later after one of the great things about Stanford are the interdisciplinary initiatives and institutes, and BioX has been a leader in that regard. And it's extraordinary when we hear, what you said about the accomplishments of BioX as an organization in supporting faculty and students to come together in these interdisciplinary endeavors. So I just want to thank you and everyone else who's contributed to making this such a great success. In terms of the long-range plan, hopefully everybody here knows something or maybe even a lot about it. It was a community-based effort that started in April of 2017, went a little over a year. I guess we rolled out a high-level vision in May that really set priorities for the university based on the input of the community over a period of 3 months in 2017. 2,808 ideas and proposals from across the campus community and our alumni for trying to think about where we should take Stanford over the next decade and beyond in terms of our research focus, our focus on education, our community, and engaging the world beyond Stanford. Tremendous work by 4 committees of faculty, students, and staff, and I see some of the members who participated in those committees in this room, and even some of the co-chairs who did an extraordinary job of distilling all of that input into themes, wrote white papers, providing all of the input and the ideas from the community, which then led in the winter months to the academic leadership of the university, Persis, the provost, and myself chairing the deans, vice provosts, and vice presidents, with constant back and forth communication with our community, faculty, staff, students, to distill down to some major priorities. And I won't go through them in detail. As you know, there's a website, Our Vision, Stanford /ourvision.org, that you can go and look at this from the main Stanford website. We ended up with 4 areas of priority. The first was focused on values and on really 3 presidential initiatives that aim to infuse values in all that we do. And again, I'm happy to talk about this in more detail if you wish, but to answer your question, I want to move on, but some very exciting presidential level initiatives there. Initiatives related to research, to education, and also to our campus community. In terms of the research, there are really 2 aspects to this. One is a priority set for developing nimble structures to support research across the university, and particularly to do what I'd call creating leverage. So to provide resources for new and risky directions, and also resources to scale activities when it makes sense, as well as a renewed focus on investing in our infrastructure and platforms, core facilities, the kinds of infrastructure that's so essential to our researchers to be able to work at the cutting edge. So that's part 1. That's really about having those nimble structures. But then in addition, there are 8 university-level initiatives, 2 focus on fundamental research, 2 on accelerating applications, 2 on increasing impact, and 2 on the digital future. And relevant to biological research, biomedical research, and application, and BioX, there are 2 in particular that are important. One is an initiative on supporting fundamental inquiry in the natural sciences, and one that's focused on accelerating application, the creation of an innovative medicines accelerator to help our researchers take ideas from the laboratory, some insight they might have into a disease mechanism, and start down the path of turning that into an application, into a potential therapeutic intervention that can help patients in poorly treated diseases. So I'd say the 2 major initiatives that have been announced as priorities are the fundamental research in biomedicine, and then accelerating application through the provision of appropriate infrastructure. Now, those are named at the level of priorities. We have some ideas about how to go about this, but really, after the announcement in May of those priorities, we've entered the second phase, we're calling it the design phase, where we're taking those priorities and now trying to turn them into very specific plans, because It's all fine and good to say we want to create infrastructure to accelerate application in medicine, for example, but what exactly, how are we going to do it? And so that this summer we're working on assembling the design teams for each of the different initiatives in all of those different areas: values, research, education, community. The deans, in fact, we're going to be having a session on Friday morning to look at the work that's been done so far in identifying leaders for the initiatives of the design teams, as well as the composition of the committees. So in this design phase, and you asked how can BioX help? So I hope that gives you a sense of where we're going right now in things that are directly related to medicine and biological research. In the design phase, BioX can be very involved. First, some of you I know will be asked, or some of you may already have been asked to participate in some of the design teams. That's going to be very, very important work as we set forth the priorities. We'll be consulting back with the various stakeholders and communities on campus, as even the design teams, as they do their work. So please remain engaged with them as well. And then beyond that, what I would just exhort you to do is continue doing what BioX does so well in terms of creating community, bringing researchers together from all disciplines, and really supporting young people and sparking new directions.
Thank you. Well, I mean, we'll keep our side of the coin, but I'm very excited to hear from you the priorities that will be part of the next phase in this whole long-range plan. And it really brings me to sort of a comment and another question. And the comment is in part, maybe it would be fun to talk a little bit about the need to remind and reinvest in fundamental science. I think it's very exciting. It is certainly for me. And the second part of it is really to talk about the Valley of Death, and which, as many of you will know, and as Mark certainly knows well from his own experiences at Genentech and as a founder of another company, Denali now, which really takes discoveries that have potential value in terms of translating to therapeutics, and somehow allows them to travel across this valley so that they will now even, pique the interest of pharmaceutical and biotech companies, because it seems to be so difficult now to get those companies attention, either for things that are translatable or even at the earlier stage, even to invest in fundamental research that we still need knowledge about in order to make better therapies.
Yeah, well, those are two very important points, Carla, and maybe I can take them in turn, maybe start with the application and then talk about the support of fundamental research. In terms of accelerating applications, so you're absolutely right. If people here in the audience make discoveries in the laboratory, some insight into what goes wrong in Alzheimer's disease or in a particular cancer or in asthma, taking that insight and building on it to develop a therapeutic intervention, and then testing that therapeutic intervention in humans is a very inefficient process with a lot of dead ends, and it takes huge attrition, great cost, and there's been progress in trying to figure out how to make the whole process more efficient and with less attrition, more rapid, and more cost effective. And it's very clear that one of the ways that we in the university can do that is by providing specific infrastructure to help with various bottlenecks in the process. And that is really the idea behind the Innovative Medicines Accelerator that really has two components to it. The first is this, that if you make a discovery of a biochemical pathway that goes awry in a particular disease, and your theory is that if you were to hit this molecular target, that you could ameliorate the disease state. So that's often what happens in the laboratory. You have some insight into what goes wrong in some disease. The next step in testing that and moving it towards a therapeutic application would be to develop a pharmacologic agent that can interfere with the protein in the way that you want, either increase its activity or decrease its activity, depending on your theory. And the making of a therapeutic intervention of a drug substance is something that industry is well equipped to do and is very organized to do, and we are less well organized to do in academia. And so the knowledge is in academia, the deep insights into the disease mechanism will be obtained here, but we don't typically have the know-how on how to move them forward. Vice versa, in industry, they have the know-how, but they don't know where to focus. And the inefficiency comes from the two communities not coming together in an effective way. And it's very clear that one thing that can really help grease the wheels of the interaction is to do some more of the work in the academic sector that normally would be done in the industrial sector. Specifically, if you have a molecular target, to not make an actual drug substance that's good enough to go into a human being, that's a very tall order, but to at least make a tool compound, a pharmacologic agent that you can use to interrogate the pathway. Again, we're not typically set up to do that in academia, and part of this concept of the Innovative Medicines Accelerator is to provide that infrastructure to our faculty members in order to be able to take those first steps. Why is that valuable? It's valuable because once you have a tool compound, it's much easier to have, first of all, to determine whether your theory is potentially correct, and secondly, to open the dialogue with the private sector around taking that to the next step. Industry typically has a hard time assessing biologic targets. It's much easier for them to assess pharmacologic agents. So that's an inefficiency there. And so we've actually started down this path. Some of this was done spontaneous here. The SPARK program is a great example of this at Stanford. The Alliance for Innovative Medicines that Chetan Khosla has helped spearhead is another example. And with the Innovative Medicines Accelerator, the idea is to take those initial efforts and really be much more systematic about building them out so that it'd be more seamless for our faculty to be able to take those first few steps. We think that will be at tremendous value. It's still part of in a sense, it's the natural handoff between the science and the drug discovery, because the pharmacologic agent enables you to do more science around your theory as well. So that's part one. Part two to the idea behind this Innovative Medicines Accelerator is that often we will have candidate therapeutic interventions, and to really understand how to develop them, whether they're worth developing, what patients they should be developed in, and what protocols, you actually need to go from studying an animal model to doing some experiments in humans, so testing, and not in the sense of trying to do phase 1, 2, 3 registrational trials, the whole kit and caboodle, but rather, again, continuing to do science to understand better the idea. Now, again, I see around the room many people who have actually developed therapeutic interventions and probably felt frustrated that they had difficulty taking them into humans. Again, we have some individuals in our community who specialize in doing this, and they can do that, but the average faculty member is not equipped to do that. So part two of the Innovative Medicines Accelerator is to sort of democratize access to that kind of experimental medicine, again, through the provision of infrastructure and the systems that you need in order to do that, including the regulatory mechanisms and so forth, which it's very hard for each faculty member to reinvent. So that's more granularity around this Innovative Medicines Accelerator, and the hope is that by putting those things in place, we'll be able to, as I said, grease the wheels in the Valley of Death. That's sort of a mixed metaphor, but to really be able to facilitate things. Now, fundamental research, the second part of your question, remains essential. We all know that that transformative advance in application, which I'm passionate about, is enabled by fundamental research. And really, universities are the last place where that kind of fundamental research occurs. You mentioned, Carla, that the concern that the private sector's moved away from funding that fundamental research, and that's happened over the past 20, 25 years or so. I don't think that's coming back. The private sector is so busy taking the insights and trying to make therapeutics with all the problems that's where their resources are going, and that takes so long, 13 years on average from a lab discovery to an approved drug. They are not going to fund a lot of early stage research. And so what will help? Well, first, we have to continue to make the case for federal investment in research. I'm pleased that this year we saw a significant increase in the NIH budget, and that reflects the fact that there's still bipartisan understanding. There aren't many things where there's bipartisan agreement on things, but in the case of support of biomedical research, that's there, and we saw that this year. We've seen one of the biggest increases in many, many years. So That's great, and we have to continue to advocate for this, but I think that Congress is actually quite supportive in that regard. So we have to consolidate those gains. Philanthropy obviously is very important and will continue to be important. And there, helping philanthropists understand the importance of basic research. Of course, many of them will understand the importance of applied research. They'll come to it through having a loved one who has a particular disease, and that's very important too. But I think, fortunately, more and more philanthropists understand the importance of basic research. We have to work on that. There's something called the Science Philanthropy Alliance that brings together universities from around the country. It's actually based in Palo Alto, that aims to develop messages and help educate potential philanthropists about that. And then the third thing is what the university can do, and that's what these initiatives are about. And again, one of the university initiatives around the support of fundamental research. The design teams will look at how best we can deploy resources to help spark new and risky directions in particular.
So Mark, thank you for that. Again, really exciting vision. The concept of an accelerator, I think, is probably music to many of our ears because, over the 20 years that BioX has existed, the seed grants have generated so many fantastic ideas, and then those have stalled out. And what we notice is that they've stalled out more frequently recently than in the past, partly because in the past it was possible to interest our industry colleagues into even sometimes co-investing in a seed grant. So that was even possible in the old days. But I think, as you point out now, the concerns of the companies have just really usurped any of this very early stage work. So, what you have ready to feed into those, the accelerator, are many, many wonderful projects, I think. So I hope, we can all help, but I hope that there'll be the bandwidth even to accept what I think is probably a kind of the breaking of the dam of all of the faculty and students who have really good ideas that they now would like to see develop further.
Well, I know I mentioned the Alliance for Innovative Medicines that Chetan Khoshla has been spearheading, and I won't go into the details of that, except to say that it is a first step in this direction of providing a mechanism for a researcher to come with a project where they've identified a molecular target and now want to make a tool compound. And Anne has actually worked closely with Chetan in setting this up, and there was a call for applications. Some of you may have applied, and there was a moment of trepidation there. Would there actually be any interest? If you build it, will they come? And it was just glorious because there were how many, Anne? 97 or something like that applications. People thought there might be a few dozen, but there were 97 applications and of course, more than could be handled, and so there was a difficult decision of how do you prioritize and choose them, but it's a great problem to have. But to your point, Carla, I think there's a lot of pent-up demand because there hasn't been this kind of mechanism. So being able to flesh that out, not just for small molecule drug discovery, which is what AIM is about, but also antibodies and other therapeutic modalities, and then expand it, I think is a great opportunity that we have here.
Well, that really, I think, leads me to another question, which is, because of these opportunities, to me, I always view these outreach or opportunities to work outside of, let's say, the mainline university themes as further educational opportunities. And in fact, I think one wonderful thing about Spark or some of the ChemH AIM and so on is that not only students but also faculty have an opportunity to learn about what it takes. And they learn about intellectual property, and they learn about all these other aspects of essentially the world outside of our ivory towers. So I think it's very exciting. And in that regard, I guess what I want to ask is, how can we ensure that these kinds of training programs, like the BioX Fellowship Program, which is really training Stanford PhD students in all different fields of biomedical and basic research, how can we really make sure that they continue to flourish, and can we create other programs similar to those? Because, you know, for BioX, we're giving out, I mean, we feel very fortunate that we can award, you know, somewhere around, let's say, 20 BioX fellowships every year. But again, the demand is so huge. I mean, we get over 90, 100 applications every year. And these are internal Stanford students already. They're here on a PhD already. They're all terrific. So again, there's this huge demand.
Well, so first, you're so right that the, you know, providing support for young people is one of the most important things that we can do. And I love the BioX fellowships, the fact that you provide people with independence so they can go forth and pursue their research interests. The fact you have this requirement of 2 faculty members, that you really require it to be interdisciplinary, and that helps forge interactions between people that, by the way, vastly outlive any one fellowship, because once people start working together, then those connections are made and they continue. So it has beneficial effects at multiple levels, both for the individuals supported, but also for our community, and increasing the connectivity and gluing everybody together. So I love that kind of program. I think, and that's one of the reasons why, as part of the long-range plan, I mentioned briefly, you know, nimble resources for support. One of the ones that we heard loud and clear from the community, that fellowships are one of the single most important things that we can provide to really maintain energy and momentum and vibrancy in our research programs. And so that is a declared priority as part of the long-range plan. Again, the design teams are going to work through exactly what that means, how many fellowships, in which disciplines, how will they be orchestrated. It will be done through departments and schools, will be done through interdisciplinary programs. All those things have to be worked out. But there's no question that the point you made, Carla, is essentially led directly to this kind of focus on graduate fellowships.
Oh, great. Well, we have more questions, but I'm thinking if there's some questions from the audience at this point, because I want to be quite respectful of our president's time and also everybody else's time. So, Michael. Maybe could you stand up, because do we have a, oh yeah, we do.
We have the technology.
Yeah, let's do. We have the technology. We have everything.
So, in some ways, it seems to me that so much of good things in science in the world are random. I mean, the whole BioX thing is random. It never was meant to happen, and happened because of the Stanford GUP arrangement. There was no space to make 5 buildings for 5 faculty, so they put them all in one building. And then a lot of these programs have happened by accident. So I guess maybe nimble planning is another way of saying serendipitous planning. I mean, it's really hard to explain planning to people who want to plan, because science is as bad as planned as winning a lottery. And I guess you have to think about how to deal with that.
Yeah. I think that's a great point, Michael. I do think that a lot of the advances come from the random collisions that occur. One of the things, so BioX is a great example of forcing, it's not really forcing, but enabling interdisciplinary interactions. And we see the benefits that come from that. There can be some social engineering, like these fellowships where you need 2 people, from different disciplines, that will actually force those kinds of interactions. And in fact, as I mentioned a few minutes ago, it actually works. So I think we do have to try to encourage that kind of thing. One of the things that I'm excited about, again, as part of the long-range plan, we've declared the importance of resources for fellowships. The other thing is to make resources available for what's been termed community building. Now, what does that mean? It means that if there are communities of individuals who want to come together to do things, typically have poster sessions, seminar series and so forth, it's often very difficult to get those resources. And so having those available so that communities can come together and self-assemble is another very important tool. So I think really trying to create mechanisms for people to interact in lots of different ways without over-planning it, to your point, Michael, I think is very important and something that the university can and should be doing.
So you talked about graduate fellowships, but I think especially for the bio community, that postdoctoral fellowships, especially not especially a little more senior postdoctoral fellowships, and dealing with housing issues for postdocs is also going to be really important. I was wondering what efforts were being made along those lines.
So again, this was addressed in the long-range planning process, and so I should say affordability is an issue across the university, affecting all segments. That said, you're absolutely right. I think postdocs are a particularly vulnerable population. We do have housing for graduate students with Escondido Village. By the time we finish that, so one of the largest construction projects in the history of the university, $1.2 billion. We will be able to house 75% of graduate and professional students, which our surveys suggest is the demand and we'll see whether it is the demand. So that will go from 55% to 75% of graduate and professional students. We have no housing programs for postdocs, and we all know in this environment with the housing situation, we have to do something. We made some immediate moves as part of the rollout of the vision in May in terms of postdoc salaries, in terms of a hardship fund for postdocs, for housing, for childcare, so beefing up those mechanisms. Those are Band-Aids at this point in time, and I think we have to look carefully at how we're going to make things affordable and sustainable for postdocs, whether that means building postdoc housing, which has not been in the cards, whether it's other mechanisms. We have a task force that is assembled, so some of the design teams are being put in place. The affordability, we didn't have to wait till May to know that affordability was an existential problem for the university. So we actually have already assembled an affordability task force that is at work and on a very aggressive timeline. And we have to do something deep and substantive, otherwise we will be in trouble. So I think we all recognize that. I can't today tell you that it's going to be this or that. What I can tell you is that we all recognize that this is an existential problem for the university. And the postdocs in particular among our trainees are those who have not been taken care of.
Time for one more question. Anyone else have a burning question? Well, let me please thank you, Mark, for this.
Yeah, thank you, Carl.
Really, it's been incredibly illuminating and I think very exciting vision. And we're all excited to be able to share it with you and to participate and help in it. So thank you so much.
Thank you, Carla.
So before we run outside, we have one very delightful additional thing to do, and that's to take a minute, which can't possibly be enough time, to recognize Ann Arvin, who's the outgoing Dean of Research and Vice Provost for Research. Ann's vision, really, for how to organize and then support and publicize, really, interdisciplinary research at a university is one of the reasons why we're all here today and why so many of the other institutes, interdisciplinary institutes at Stanford, are thriving today. It's an amazing accomplishment. She's done it over the last 11 years. I know that because I have been privileged to be a very small part of her very big vision. And it's been a really special time. And I think we'd like to all, on behalf of BioX and our community, really thank you for what you've done for the university in terms of not just making interdisciplinary institutions, but as Mark has said, really helping to create a community of scholars that we're still all the same scholars sitting in our departments and our schools, but now we have kind of new interconnections, and those couldn't have happened without you. So thank you so much, Anne. I hope you don't mind coming up for a minute, and I think perhaps.
Hello. I just want to add my own words of thanks also to Anne. I've actually known Anne for many years now. We actually did some things together when I was at Rockefeller University before coming here. It's been a real delight to be able to work closely with her hand in glove for the past 2 years. And lest any of you think that Anne is resting on her laurels, just this morning she wrote an incredibly long memo analyzing intellectual property issues. You know, she's just a couple of weeks away from stepping down. And she is going, firing on all cylinders and continues to make extraordinary contributions to the university. And knowing Anne, I know she'll continue after she steps down as well. So it's been just a real privilege, and we're just so thankful to you, Anne. We're thrilled also that Cam Moeller Anne is passing the baton to Cam Moeller. They've been working hand in glove for the last little while, and we're really excited to have Cam come on board. But we're thrilled that Anne will be here to continue to help as well, although we do hope that you'll take a little bit of time for yourself after giving so much to the university and to the community. So thank you very much. Great, so thank you.
Thank you both. Thank you
so
so
much.
So we have, just in case Anne doesn't remember how much we care, we have 2 things to give from Haida Fateh, on behalf of BioX. Something transient and something permanent. So this is it's a pin. It's a pin with the BioX insignia on it.
Okay.
And we.
It says Anne Arvin for president.
Yes, it does. Anyhow, thank you, Anne, so much.
Thank you. I will wear it with pride.
All right, music, drinks, and posters await outside. Thanks, everyone.
Till Anne and Mark and Carla go up first, because I have another surprise for Anne. But let me get